Good evening, Supervisor Bjork.
Oh.
Am I unmuted now?
Yes, we
Yes.
can hear you.
But I gotta push a button.
No, when you're unmuted, you don't have to push the space bar. But if you're muted and you want to talk quickly, then you push the space bar and it will unmute you. So you're fine right now. You don't need to push the space bar.
Nope.
Back to video.
Thank you.
For some reason, it's asking me for a meeting passcode. I can't see you. Oh, yeah, good.
Okay, now watch. I'm dropping it down right now.
Alex,
Oh,
940214.
Okay, first I close.
Well, we gotta find out if Larry got his machine. That's just-
We will give it just a minute to get everybody connected.
Oh, now it's.
May I ask Larry?
Hey Larry, do you get all your machinery now?
Ended up buying a new baler this week.
Things will go smooth now then.
Yeah, except I have to sort of explain it as it's a new pickup truck that makes hay.
Sounds good to me. Makes sense.
Billy Lamb, I really like your haircut.
Thank you, Gary. It was nice of you to comment on it mid haircut the other day too, by the way.
Walmart getting a haircut. And I lipped off. Yeah.
You?
Yeah.
I don't believe it.
Yeah, I didn't want to, but
She didn't take enough off, Bill, I'll tell you that right now.
No, I know, it's a little too much on top. So, but, you know, there's not much to work with, so.
We still have one connection to make.
that's it. Yeah, that's.
I hope that's not a fun line.
That's what I was thinking.
That's the only nice thing about being home.
Matt said you might want to get started.
Okay, well, it's 6:02 and I will go ahead and call this meeting, regular meeting of the Dunn County Health and Human Services Board to order. I see on my screen that all the members are present. Can we let the record show that? All members are present. Welcome, everybody. I am obligated to announce that if you are fully vaccinated, you do not need to wear a mask. If you are not fully vaccinated, masks are still required in the government center, but it looks like we are all ready to go, which is very nice. Just very nice. We need a motion to approve the minutes
I so
for
move.
May 27th. Supervisor Steen moves. Is there a second? I'll second. Ms. Barker seconds. I would note that I do not believe that Sarah Schaefer was at the meeting last month.
That's correct.
That would be a correction.
Oh, do I have her on there?
Yeah. Come late.
She didn't come. There was, her last meeting was the meeting
Oh.
prior.
Oh,
It was
I
Dr.
will
Hall's
correct it.
first meeting.
Yeah.
So,
I
so
thought she came late. Okay.
correct that.
I had a question too, because like Casey Gallagher, Chris Propella are not on there. Do we normally list everyone who attends or just?
We do
Just
not.
the committee members.
Just the committee members.
Okay, thank you.
All right. And please keep asking questions if we do things that don't make
Will.
any sense. All right,
Thank you.
I've got a motion and a second. Any further additions or corrections? If not, all in favor, say aye.
Aye.
Opposed? Minutes for May 27th are approved. Do we have any public comment, Krista? I take it that's a no. All right, we'll assume that that is a no. We do welcome public comments, but none tonight. The
I'm
next.
sorry, my computer froze up. Yes,
Oh,
there's no public comments.
All right, Kristen, thank you. Thank you. Our next meeting is Thursday, July 22nd. I mistakenly thought that was the third Thursday, but it's not. It is the fourth Thursday in July. So we'll see you at 6 p.m. I won't be there. Ms. Barker will not be able to attend. Okay.
I'm going to actually be on vacation.
She's going to be on vacation. That is an excellent idea.
22nd is, oh,
It is. I know. I missed that too, but it is the fourth Thursday. Okay, veteran service report. Mr. Quinn is on vacation and he is such a consummate professional that he's joined us. So it's all yours, Greg.
Good evening, everyone. I had some limited materials in the board packet this evening because I've been out for the past few weeks. So I'll first thing that I'll address is just overall veteran served, and I'll start with the veteran served report, which is an Excel document. I typically put an impact statement on there. However, did not include any impact statements for the July report. I will add some additional impact statements. I do have one that I will talk about this evening because it just happened here this last week that I was alerted to. So specifically kind of I look at this veteran served report. Honestly, it's business as usual, and I would say that there has been always around Memorial Day there is an uptick in individual contact, face to face, as well as phone contact and additional items. And again, a lot of the uptick surrounds veteran related holidays. Because there's family members, genealogy type stuff, as well as benefits, kind of the to-do list that individuals will be reminded of that they should inquire into or they should pursue. So outside of that, nothing additional or significant that really would come outside of that, other than normal uptick that trends around that Memorial Day time frame. There is locally, we are working with the Historical Society. I think I gave a little bit of information last month on a September project that we're going to bring in. I think the name of the project, it's coming from the Veterans, the Veterans Historical Society, or the State Historical Society, and it's faces to names, and it's a kind of a billboard type display that we're going to have a few other things that'll accompany it that'll be at the Historical Society, and it's of Wisconsin Vietnam veterans that were lost, and we're working on surrounding that event, using it as an outreach, of course, and an educational piece, because if we can draw in even one additional veteran to receive benefits that they've earned, that could really take an impact as we look at the county financially, if we can get them tied into some other service. That's the end goal. And a significant impact as far as on an individual. I'll just give a little synopsis of this, and I'll have additional dollar amounts on the direct impact for the July report. I had conducted a Board of Veterans Appeals hearing with the Veterans Law Judge for this particular veteran who had service during the Vietnam War in the country of Thailand. Thailand, it's very, very difficult to get the Veterans Administration to approve Agent Orange contact. It has to be direct contact for any service in Thailand, because they'll only recognize that they sprayed along the perimeters, because there was sniper attacks, there was a variety of action that happened in Thailand, but it's not very notable. And so based upon past information that I've used for other veterans appeals, and going through and conducting the hearing and having the testimony of the veteran, it's taken 5 over 5 years that we got it approved at this level. It's I haven't run the numbers. It'll be posted here soon, but it'll be over $100,000 that he'll receive in retroactive pay. And he lives right in the county of Dunn, so I suspect some of that money will get poured right back into the county. So I'll be, once I get back to full duty in the office, then I'll be able to get that additional information. But that's a significant win because of the nature of that Agent Orange exposure, because we had to prove that he actually was on the perimeter of the base. So I'll have more details next month, but I thought that was definitely noteworthy. I don't have anything additional to report as significant on the state level or federal level at this point. If there's pending any questions, I can then just draw your attention to the current budget status at this time.
Any questions for Greg? Yes, Supervisor Steen.
Greg, how are we coming on moving that memorial over to our offices here, our grounds here?
So I would say slow. That's probably the best response, but to give you a more specific update, we just got a drawing back from the graphic designer. That doesn't do it justice, but that's what we're looking at. We needed to get that drawing back, so then we'll pursue some financial donations, because again, it has to come at no cost to the county is the direction. We have close to $17,000 raised without really doing anything, just word of mouth. And I anticipate it's going to be 35, 40,000. We're getting updated estimates, but we have to get the granite ordered. And there is a little bit of delay because we followed up with the monument company. We got a couple of tweaks with the graphic design, and then we'll solicit some additional funds. So that's the best update. We're still optimistic about the fall, but much is going to be dependent upon, because we have it tied into the parking lot out front, because it only makes sense when they come in to redo the parking lot to set the grade for that project as well.
Thank you, Greg.
And
You're
Greg,
welcome.
you're estimating total cost is in the neighborhood of 40,000?
Yes. Yeah, there's some delays on granite. I can't remember the country that the granite will come in from, that the monument company then does the final polishing and stuff of that. So I'll keep you informed. But in the end, it's best to do it right than to kind of hastily put something together. But we want to get, I'm hoping for the pad and the flag poles at a minimum, but we'll be optimistic that we'll get the other items set. And it didn't help that the federal government added Space Force when we made plans for 5 branches of service. So we got to figure a little workaround for that, because everything's based upon 5-sided, 5 points to the star, 5 benches. So we'll get those details worked out.
I have a question, Greg.
Yes.
Maybe anywhere in the vicinity of that old fountain that's already out there?
No, as you come in the new entrance, and if you look to the north off to the left, there's a couple signs that are in the ground that say the home of the new Eternal Flame monument. And I'm trying to think of it's just adjacent to the handicap parking on the front of the building. That sidewalk's going to be extended. And so it'll be the first thing that you will see as you drive into the government center. I think I got to get the new name correct. Is that helpful?
Yes.
Pending any other questions, I'll just move on to the budget.
I
And
have a quick question. Greg.
yes, ma'am.
How did the Memorial Day event go?
Excellent. I thought it was, well, we couldn't have asked for better weather. That that always helps with bringing more people out. But from my vantage point, it's always good when you can have, especially with what's been going on the last year and a half, to get individuals to feel comfortable with coming out and seeing and getting involved in something that really is honoring those that have passed. And the weather was great. Nick Lang, who's a corporation counsel, as well as a Army veteran, was a speaker, and I thought he did an excellent job. So it was good, smooth event. A lot of dedicated individuals that participate.
Great, thank you.
You're welcome. So related to the veterans budget, at this point of the year, nothing significant that I would draw your attention to. We're on course. There's nothing, no friction points that I anticipate that there'll be any budget issues as we go forward. There's typically we don't have the strains that a lot of other departments have when it comes to some costs that are variable. Ours are pretty easily controlled.
Any questions for Veteran Service on the budget information that you received in your packet? If not, moving on, thank you. Thanks
All
very
right,
much
thank you.
for giving up your vacation to join us.
Just upstairs.
You can leave if you want to. Okay. Department of Public Health. Our Public Health Director is in Colorado, and we are glad that she's here to join us, and she's been having some computer snafus today, but hopefully all will be well. KT?
That is absolutely my hope. Do let me know if my connection is unstable. I have had that flash up a couple of times today during the meeting.
Okay.
So in your packet this morning, what went out is the typical situational report giving you an update on COVID-19 in Dunn County. You also had the Western Wisconsin Regional Public Health Readiness Consortium's update, and that is live linked so that if you guys go through that PDF, there's a lot of additional reading there for you as you care to follow up. And then the other thing that you had in your packet this morning is also from the Western Wisconsin Regional Public Health Consortium, and it is a timeline of the regional response to COVID-19. And so if you think about the last 16 months, it really puts some timelines to the activities that consume the health departments here, both locally and regionally. I did want to point out that the first case in the region was in March. In February, we started working with people returning from China and following up with them as close contacts. So middle of the night phone calls started actually on my son's birthday. So mid-February. So a lot of work for a long time, and we are just now starting to move back to resuming more normal functioning. So very grateful that we have had almost a month now of 5 or less cases a week, which is fantastic. To be considered a low activity level in the state of Wisconsin would need to be less than 4 for 2 weeks in a row. And so we've not quite hit that level. If you look at the Brown University School of Public Health and site and their metrics, we have been seeing their medium and their low activity. So definitely in a good position there. And then as far as other updates, I know that it's agended later. If there are any other questions, or if there are any questions, COVID, I will move on to another item that I wanted to address with the board today.
Are you going to talk about vaccinations, KT?
Sure, I can talk about vaccinations. So in Wisconsin, about not quite 50% if you include veterans. So if you look at the CDC website, they have the veterans vaccinations included in our total vaccinations. So we are over 50%, but the VA does not report to the Wisconsin Immunization Registry, so that if you look at the Wisconsin data portal on vaccinations, we're just under 50% as a state. Here in Dunn County, 39% of our residents have initiated the vaccination series, and a little over 36% have completed the series. Still a very long way to go, and definitely some lagging interest in vaccination at this point in time. So last week we completed as a county just over 300 vaccinations. So I'm definitely seeing some diminished interest in vaccinations.
May I
Any
ask?
other questions? Of
Yeah,
course.
I do have a question, Katie. I was in Eau Claire yesterday, and at a small coffee shop, there were 3 public health nurses and a sandwich board sign out in front giving vaccinations. I also noted that today in today's paper, there's a tavern in La Crosse that's doing vaccinations. I wonder if you could talk a little bit about plans for sort of off-site or, call them pop-up vaccinations in clinics in Dunn County.
Sure, and I have not been in the office since last Thursday, so a little bit of a lag of information. So when I left last Thursday, we are working very closely with WestCap to do pop-ups associated with meeting their clients' need at a church over on the. They're also working with businesses as they're interested. We did send out a survey to all of our licensed facilities here in Dunn County to gauge interest in co-sponsoring. So kind of like the coffee shop doing shots for shots. It was a shot of espresso, just to be clear. Then we did not have the same interest in our local businesses. I know that Supervisor Steen was going to follow up with a connection, and we'll come back when I get back in the office. We'll follow up on that one up in Colfax. But pop-ups, if we do have, as Supervisor Steen, we talked about at the county board meeting, the health department has some work to do as far as meeting the community where it's out in the remote areas of the county. So making it out into some of the villages and townships. But I can't speak to any progress on that since that was Thursday and county board was on Wednesday. So I apologize for not having a more substantive update on that.
No, that's all right. I've had several supervisors talk to me about townships, particularly in the northern part of the county, and the possibilities of going to rather than asking people to come to Menominee. So anyway, just something to add to the mix.
Thank you.
Last night at facilities, that subject was brought up, and racing would be open to you setting up something at the races and trying to get that population vaccinated if you're interested.
Thank you for that, Supervisor Bartlett. We are working with both the fair and the races to actually bring in National Guard to do vaccinations, just to meet the community there that's interested, but also I think that there's a different level of interaction with a guardsman in uniform than a public health nurse, and so just want to make sure that everybody feels comfortable there.
Good, thank you. Go ahead.
Sure. So financials are next, and what you'll see in the packet is that we have moved a significant number of people appropriately around from Public Health Administration to grants. So that's much more on target. However, one of the things that Sarah and I discovered is that there is additional communicable disease grant funding that's not represented in our revenues. And so we have a new finance person that should be starting this week. We'll meet next week for the first time. And so one of our first jobs will be to track down where that is in the process of budget adjustments and get that represented in SAP. It is specific for contact tracing and for vaccination. So as that work diminishes, which it absolutely is, there will be less availability for us to tap into that resource, but it's not fully presented there in the budget in front of you. Any questions?
Any questions for KT?
I have
Yes,
a
Dr.
question, KT. So, and you're on vacation, and so this is maybe a request for an update at the next meeting. Is I just saw today that DHS, is kind of advertising that they're going to offer testing services to any school districts that wants them, and somehow match them with local resources to do free testing in schools. So I would just be interested to hear what you learn in the next upcoming weeks about how that all is going to work and how we find out or encourage, or who knows, our local county school districts to see if they might be interested in participating.
Absolutely. So that's one of CDC's main tenets in safe return to schools is adequate testing. And so what I understand, and this is broad brushstrokes, I haven't seen any dollars attached to this, is that there will be dedicated ARPA funds from the state through the locals for schools specifically around testing. I think there's still a little bit of negotiation around how easy that funding will be for schools to access, specifically around the staff time to do the data entry. As Carmen, the neighbor's mentor, will share with you, it takes a significant amount of time to data enter each and every antigen test. And so that's really a challenge and a barrier that our local schools just cannot overcome without additional funding for the staff time to do those two jobs. So I'm hopeful that there will be enough funding and not too many strings so that we can encourage schools to the state up on this opportunity to, again, contact trace when we've got kids that are symptomatic, we can quickly exclude. And then kids that are contacts, we can do that baseline testing and then send them for a PCR if they are asymptomatic as a contact. So my hope is that we'll get there, but I don't have, this is another area where they're still trying to figure all the things out in order for the school year next year.
Other questions for KT from our members here gathered or on Zoom? No, moving on then, KT.
Thank you. So I was approached last week by Bob Colson. He is leaving the county, the county planner, and he wanted to start the conversation around the health department housing the sanitary sewerage program. So for folks that don't know, if you're not connected to municipal sewer, you have something out in the backyard or the front yard that collects and treats effluent in a way that protects health as well as water quality. So in many other states and counties, the sewage system, private sewage system or POUTS program is housed within the health department. It was for me here. I had 3 inspectors that conducted both the septic maintenance program as well as inspections. And so to me, it's a very good fit for the health department to continue conversation around, can we make it financially viable? Can we provide a little support for the current POUTS inspectors with our own environmental health specialists? And can we provide a good service to the people of Dunn County? So in Eau Claire County, one of the things that I'm really proud of is that we had a fantastic manager of that program, and he did active and regular outreach to the installers and was known within the region and the state as an expert as far as plan reviews go. My hope is that we can have that public health lens to septic, but I want to make sure that the Board of Health also believes that it is a good fit for the health department. I believe the alternative would be contracting it out. I'm not 100% sure on that. Any questions or thoughts that you guys have?
KT, we had a lengthy discussion about this at PRND yesterday morning, and I think that discussion, Chairman Bartlett can correct me if I'm wrong. I think that discussion is ongoing, but there is some sentiment to approve moving the POUTS system into the health department, but it needs some continuing conversation
Where is it right now?
in the environmental services.
In zoning.
Any thoughts from the committee? That'll be on, we'll be talking about this some more. Dr. Hall, did you have a question?
Well, it would probably make sense, from that whole kind of environmental
does.
health standpoint, more kind of fits with the philosophy of health services and environmental health than zoning, perhaps. Yeah. So that might be a great.
Yeah, so we'll work out some questions about staffing and budgeting and yeah. Anything else?
And that is the next step. So tomorrow morning I'll meet with Bob. It's his last day. And we'll talk through the funding streams and fixes whether or not we can make that work. Given that there are opportunities to recoup costs that they don't currently take advantage of. So like the SEP maintenance program doesn't have any fees associated with it at this moment in time. There's obviously work that goes into not only the data collection, but also the assurance component, make sure that what people are submitting is accurate. That is the very first step was the conversation with Bob, and then we'll continue that conversation when I have more details fleshed out if you guys are in agreement of that.
Yeah, I think it makes absolute sense to move forward with those discussions. I think it's quite prudent. It's just that it's a little complicated. So.
Jody's got a question.
Yes, I'm sorry, Supervisor Cromrie. Thank you.
Is Bob available for consultation even after his retirement, since his retirement is so upon us?
He is. Yeah. He is moving to another position, but yes, he will be contracted to help out while some of these details about who picks up the responsibilities of the planning and zoning administrator sort of shake out. But yes, he's available.
Okay.
Supervisor Bjork.
KT say that her and Bob were going to flush something out.
No, I didn't mean it as a flesh, but I like flush better. Thank you so much.
You just couldn't resist, right? Okay, any further questions, discussion? Okay, thank you, KT. I think we're moving on. Health and Human Services staff report. We have a bunch of things on the agenda tonight.
We do. So I apologize that I sent you kind of at the last minute today a couple of documents that go hand in hand, but they're nothing that you can't, if you're interested, read. Didn't get a chance, you can't go back and read because they're really just reference documents of some things that are sort of moving and shaking in the Health and Human Services world. So the first document that I sent you was the economic support COVID-related changes document. So for the last year or more, depends on the change, but for the last year or more, people who receive food share benefits have been receiving extra benefits, federally funded, and people who have been both in the food share and in the Medicaid program, people have, if you came onto the program, typically you would need to provide a significant amount of documentation to support your eligibility, and you would have a regular review of that eligibility. And a lot of those rules have been suspended during the pandemic. So essentially it made it very accessible for people to have that Medicaid coverage and food share coverage during the pandemic. However, those changes are not going to last forever. And so they will reverse, and the anticipation is that that's going to be frustrating and confusing to people because the changes will happen. And, you know, like like any of the rest of us, if we had an increased source of income for the last 18 months and then suddenly it disappeared, that would be frustrating and difficult perhaps to manage. So especially when this is a population of people that are working on a lower income. So it's kind of it was an awareness of those changes that will come at some point in the future. But I also thought that it was so interesting if you had a chance to look at the numbers that are associated with those increases. So particularly for Dunn County in March and April of 19, 20, and 21. In 2019, there was $691,000 worth of food share benefits dispersed to Dunn County residents. And in the same 2 months in 2020, which would have been the beginning of the pandemic, that number is almost doubled. And in 2021, it is more than or about 3 times as much. So, so there is an additional $1.4 million every 2 months coming into the current economy, and also supporting the needs of people that are of lower income status. And that is going to change. And so I just wanted you to be aware of that because it's a somewhat significant amount of money.
I have a question.
Yep.
Do we know how much of, when we think about how much that's going to change, do we know how much of this is people actually truly are newly eligible and they will continue to be eligible? Is it just increased numbers of people, or how much, like, how much are we going to lose and how much are people going to be really impacted?
So I think if I understand you correct, there's really kind of 2 sides to it. So some people who previously did not receive benefits, perhaps were unemployed, whatever happened at the beginning of the pandemic, and came onto the program. And they've continued onto the program, even if they went back to work or whatever's happened, because there haven't been those reporting requirements. So, so some people were truly new recipients, but everybody who was a current recipient also is getting more. So really, there will be some people who will come off, but I think the greater concern is, okay, sometimes common sense doesn't prevail, but commonsensically, if I qualified for, say, for food share back in March of last year, and now I'm back to work and whatever, I probably will understand that my benefit will go away when it's reviewed. However, if I've been receiving an extra $95 per child for the last year and plus, just as a regular part of my benefit package, and now that's going to go away, that's going to be the harder transition for people.
It might be devastating for some people.
Yeah, because, again, we all would become adjusted to that. If somebody just gave you $100 every month, you would quickly adjust your spending to, use that $100. So,
And as you point out, it will affect the food industry as well, grocery stores. And, there's some ripple.
places
effect.
like Quick Trip do an amazing amount of because the amazing amount of business related to those benefit cards, because they have inexpensive, milk, eggs, cheese,
exactly.
whatever those things are, that are lesser expensive perhaps than sometimes even in a grocery store.
When is that going to quit?
Unknown. So the $95 extra per month, minimum $95, so some are more. So just as a personal example, I have a disabled brother, adult disabled brother, and he, before the pandemic, legitimately received food share, but he received $17 a month in food share benefits. And now he receives $167 a month. So when that changes back, he will,
That will be a big hit.
there will be a big change. Yep. So that particular piece is on a month by month renewal. So it could kind of change at any point in time. The increased allotment by 15% to all households is expected to go through the end of September. Could go through the end of the year, but through the end of September. And then we don't know yet when all of those kind of review and renewal requirements will be reinstated. The other potential, and I might have mentioned this last month, the other potential direct county ramification is if someone qualified for Medicaid coverage close to or during the pandemic and didn't have to provide all the things that they typically would provide and have Medicaid coverage and went to like the neighbors, they could very well, once they have to provide all the information, lose their Medicaid coverage and not have a payment source for their nursing care stay. So, and again, it's impossible to know what those numbers would look like, but that's another population of people who are directly, because nursing homes have rules around once you're admitted into a nursing home, you can't just be tossed out onto the street. So even if you can no longer afford to pay.
So is it part of your department's purview? Because I'm still learning to like, do you know who those people are who got onto Medicaid in the past 18 months? Can you reach out to them, let them know this is coming? Do you need
So
help
they
getting your documents?
do, but so there are about roughly 5,000 cases in Dunn County. So it's not a per person, per individual, like I could tell you, I mean, we could print a list, some kind of theoretical list of all of those recipients. But all of those notices are automatically generated out of a state system. Okay. So it's not like we generate that information. We do operate the Great Rivers Consortium, a call center, which is where people call then when they have concerns about what's happening. Okay. And so we will sort of secondarily get those opportunity to touch those individuals, but the heads up piece comes in, if it comes in a weird looking government notice kind of document that's probably hard to digest and not necessarily something you're going to necessarily automatically pay attention to.
Right. Would it make sense for the consortium to put together a FYI change may be coming?
So don't think that they have an ability to do that in and of themselves, because consortium wise, it's about 60,000 people and they just don't have, the system is a statewide system. So there's not an ability to pull that data out and then create some sort of a notification, whatever. If it comes out, it'll come out on a state. If and when it comes out, it'll come out on a statewide level.
I guess I'm wondering about like a PR campaign, just public messaging saying things are going to be changing. If you knew we got onto these benefits, watch your mail.
Yeah, I know. Part of the difficulty, part of that, and it's true in many different arenas, and not that there's not validity to that there's no one source of getting those information out anymore. People don't necessarily read a newspaper. They don't necessarily watch television. They've cut their cable. They don't necessarily follow social, it's like, it's really getting that out in an effective way is complicated. And I mean, I anticipate that the state will generate some notifications as those things start to happen, but as a general rule, it's government that creates notices that are not necessarily all that readable.
Supervisor Steve.
Consortium wouldn't have any money to do it.
Yeah, well, I don't potential. I mean, I don't know an answer to that question. The issue is the capacity to pull data. We don't have the ability to pull data out of the system, except on a like one by one case basis, which is not going to happen for 60,000 people. So that's a big change in that world. And then the next thing that I sent you were 2 documents, and this is just for your awareness. So several programs that are Medicaid funded have program audits that happen on an annual, sometimes in every couple of years or maybe even 3-year basis. One of those programs is the Birth to 3 program, early intervention for little kiddos with delays or disabilities under the age of 3. It's a mandated program. We have a considerable amount of county levy in the program. We have to serve everyone who's eligible. We probably have upwards of $300 or more $1,000 of levy in the Birth to 3 program. It was one of the initiatives that we asked for in all of our legislative meetings, and the governor had proposed additional funding to that program. It did not come through joint finance, that additional money. So, so the funding will be essentially what the funding currently is. In Dunn County, it's about a $600,000 program, and we get $128,000 of state funding towards that. Then we have some revenue that comes from billing third-party payers such as Medicaid and private third insurance companies, about $100,000 of revenue there. So every year there is a program audit. It's not a financial audit. So when you hear audit, you often think finances like the IRS, but it's a program audit. So basically, are you doing the things that the state and federal legislation requires that you do in the Birth to 3 program? And historically, the Birth to 3 staff, and you can't lump all staff into one lump, but you can know that, I mean, as a general rule, someone who's interacting on an in-person basis, on a daily in-person basis with little kiddos under the age of 3 is probably pretty sweet and conscientious. And I don't mean to like diminish what they bring to the table, because they are wonderfully talented and self-sufficient, also self-sufficient group. But they are very, very conscientious about the work that they do. I think that there's not a lot of places where you can sort of say that across the board, but I think the Birth to 3 program, that is an across the board thing. So historically, counties have done very, very well in those program audits. The state contracts with a private entity, or a consulting entity called Metastar, who does those audits. And so this year, in those program audits, it's been sort of the talk of the state for the last 6 months. This year, as those audits rolled out, counties began to fail miserably in those audit processes. And some of it, so the sort of the official word, and if you read both of those letters, the official word was that the state needed to prescribe to the consultant that they needed to be looking at more things related to the federal requirements. And however, there's all types of now anecdotal and documented information that there's a wide variety of things that are happening in that program with those audits. So some of it is auditor training and what they're looking for and how they're able to find it. As in a lot of things, they're not subject matter experts about Birth to 3. They're trained to look for a piece of paper with a certain title on it, and sometimes they're not getting that right. If there's a category that they're looking at and there are, say, 6 different measures in that category, if you get a 0 on any of the categories, you fail the entire category, or the entire group. So if you had 7, 7, 7, 7, 7 and a 0, you get a 0. So counties are coming away with, out in the scoring, coming away with a heavy number of 0s and 1s. So it's a major source of concern, both to the counties, as well as many policymakers across the way around, like, well, so we have thousands tens, hundreds of thousands of dollars in this program, and you're telling us it's not doing what it's supposed to be doing. So the Wisconsin County Human Service Association wrote to Jim Jones, who is the Medicaid director for the state of Wisconsin, and basically said, you know, this isn't working. Something's wrong. If it's a matter of 1 or 2 counties that aren't meeting the mark, that's one thing. But when everybody's falling short, there's something wrong with the tool. And so they did temporarily suspend those audits. Ours isn't due until, I want to say, like October. But they did temporarily suspend them. However, if you then read the response from Jim Jones, it essentially was like, yeah, we appreciate that. Maybe we could teach you a little bit better about what we're looking for. But I suppose I'm being recorded, so I shouldn't say suck it up, Buttercup, but suck it up, Buttercup. Kind of, there wasn't a lot of give on kind of changing that process and protocol. So it's still in, the counties aren't giving up at this point in yet, because it's such a big deal, and the staff have been totally demoralized by the process. And so, in fact, some long-term, really talented people have just retired because they're like, we don't need to, not in our county, but in some other counties, we don't need to do this. So I just wanted you to be aware, because you might hear that sort of gurgling around from some other, any other circles, but it's a bit of a mess at the moment.
So if you get a bad score, is there anything, does anything happen to the
No,
county or
'cause
the
it's-
program? They can continue on?
Yes. So yes, it doesn't have a financial ramification. I mean, ultimately, those program audits could have a financial, I mean, if they say, here's an issue, and then you don't correct it, and they come back and you still have that issue going on, you know, you can ultimately end up with a financial penalty, but that's not the threat at this point in time.
So probably going forward, as they have learned, you know, the people doing the audits will learn more as they go, and the counties will learn more on what they're looking for to make sure they give them the right information compared to what they used to, that it'll probably get better.
It
by
should improve.
itself.
One could hope.
Question.
Yeah, Supervisor Steen.
So the legislature eventually approves.
Can you speak in the mic a little bit more, please?
Yeah.
The legislature at some point approves the money for this program, correct?
Yes.
So if this would continue with all these negative scores, that could have a negative impact on the outlook of the legislature on this program. Is that correct?
Sure. That would be one potential ramification.
I got another question for you on this. James Jones, is he a relatively new guy to this?
No, and he's actually a pretty decent guy. I mean, in the sense of, I think that he has tried to be a good collaborator with the counties for the most part. So, but I'm not sure what's exactly going on with this whole
Well,
program.
it would seem to me that if the people that are going to fund it are utilizing this report as part of their information, that at some point in time, they're going to say, this is not working and we are not going to fund it. So would we be jumping the gun to contact our representatives on this?
That's a good question. I'm not sure I know an answer to that question. I guess what I would ask is that I have the opportunity to circle back to our professional association and just ask that question.
I would think too that there's got to be a committee in the Senate and also in the Assembly that would be responsible for this. So, you know, like a 4, 6, 7-man person committee. And maybe that's where we should direct our, you know, you can find out. It's just a question I have, but in the end, you have to justify your existence, and it would appear to me, and it doesn't look to me like, and this might be a partisan comment, but it doesn't look to me like they're overly concerned about making things better at the local level. They fix their budget and then they look good and it rolls downhill. You're supposed to figure out how to do it at your level. And that's kind of short-sighted in a way, because did you really fix the problem? If the taxpayer is the guy footing the bill, whether he foots it for the state or the county or the township, he's still footing the bill.
Okay.
But you look good, if you follow what I'm saying.
And
Yeah,
this is a
thank you for
good
raising that-
program.
Raising the question about contacting legislators, because I did think about that too. It seems a little premature, but
I have a question, Chris. This program's been around for a long, long time, since the early 80s.
I would say that's probably a fair.
Yeah, because I remember seeing it at a meeting that probably decided to go with it.
Can you speak into the microphone, please?
I'm sorry. That's right. I know this program's been around probably since the early 80s. And it's been a good program, and I'd hate to see anything happen to it, some of these kids are in desperate need of this help. So,
And it's been a quality program.
yes.
I think
yes.
the counties wouldn't be nearly as up in arms if they shared a similar concern. But I think the disconnect is between knowing and believing and knowing that we're doing a really good job, and the scores are not reflecting that, and they're new scores.
yeah, Supervisor Steve.
Chairman Diane, I would ask that you do that, Chris, and then report back to us on the information that you get. And if your organization feels at this time it would be, I don't think it's ever too early to talk to your representatives about it, because my brief experience with this, both as a family and a grandfather and a worker in a school system, and being involved in the village, it is a very good program. I mean, it's I think it's a difference between letting someone just hang adrift or helping them get to where they ought to be, if you know what I'm saying.
Can I ask a
Yeah,
question?
please.
Chris, I'm assuming that it's similar to the school setting, where when you fall in that category of low scores, you have to develop a corrective action plan.
Yes.
Okay. Which is really hard to do, because if it's their scoring, that's the problem. Being in special ed, I understand. And the Birth to Three program is wonderful for, we work so closely with schools. That's our child find, and they help with that. So, yeah, and unfortunately, the current legislative body doesn't value education, and in any means, the way I've seen it at least, no funding is there for the increase for Birth to Three, which is where we really need it. And we also need it for the schools that need as a partnership. So.
And the program is just woefully underfunded, so anything that would put that at additional risk is not at all appealing.
Well, and it's really hard to develop a corrective action plan when it's a scoring problem.
It's an instrumentation issue.
And coming into it, especially this audit, you're looking at some data from the COVID side of it too, and trying to meld everything. Yeah. I'm just glad I don't have to go through an audit for special ed this year. Let's put it that way. I did it last year.
Chairman Bartlett.
Well, I guess that's where it's coming from, is if they were going to decrease funding because of that poor audit,
Right.
that if they're not going to do that, then I think hopefully they realize that it's not a perfect system yet. Give it some time.
You're crackling pretty bad. Can you get closer to the mic?
Okay,
Sorry.
Good, everybody.
yeah. Because they haven't decreased funding, that hopefully the audits will get better and they'll improve things on how they do it. Maybe by October, they'll have some of the kinks worked out,
Maybe.
and you'll have some idea of the information they'll be looking for when they come here.
I think the concern on the county, part of the county's association is not losing the state funding. It's losing the support of their local boards.
Right.
And their local parents
Sure.
who have children in the program, who everything sort of gets published and is available for you to go out and look at, and the results of the audits and the reviews. And I think there's just a concern that there are potentially unanticipated consequences for changing the structure to the audits without proper preparation, and then having so many entities do poorly.
It ain't broke, don't fix it.
All right, let me just run through a couple of things really quick, because I do want to spend a little bit of time on the finance side of it. So just a real quick, you heard so much about CDBG and the transitional housing program, and I just want you to know that those all of that program is up and running. We've actually paid our first bills for that, or paying our first bills for that programming. There are 2 homes now, one for men and one for women, and the woman one is full. I'm not sure of the status of the men's one, but people are housed and being served and receiving case management services, and it's doing what it was supposed to do. So that's great. Yeah.
And still accepting donations of goods and.
Still accepting donations of goods. Yep. Mostly like personal care items and those types of things. Yep. And then the other thing is another item that we've talked about a lot is mental health bed space, and the legislation attempting to find funding from the legislature to support HSHS in Eau Claire to expand. They are willing to expand youth and adult bed space for mental health services and need $15 million to be able to do that. There was legislation introduced in this legislative cycle to do that. It had gotten through both of the preliminary steps of the process, but it's stuck in there's so many names for things, but I want to say the House something committee. I don't know, but it's stuck waiting for hearing there. However, there, according to Representative James' office, it is in the biennial budget, the $15 million, and it's sitting on the governor's desk. So whether or not he vetoes it, that would be one potential outcome that would eliminate the money. But if he signs or works, if the budget agreement holds and he signs the budget as it exists, the $15 million for HSHS is in that budget. That would be amazing. That's probably not the only thing.
Yeah, but there are lots of other budget issues.
He
Yeah,
won't sign it as it is.
I don't think so.
I don't know. We would be rich if we could predict.
I'll bet you
Wouldn't we?
Coke- I'll bet you Coke bill.
All right. So, we are just a couple of months away from budget deliberations or presentation at our August Health and Human Services Board meeting. We will review the 3 agencies' submitted budgets. And so I wanted you to have an opportunity ahead of time to have some information and the ability to read, digest, ask some questions. I am willing to come back to this information as often as you need to in order to sort of feel like you've got a grasp. But I tried to do the best job that I could to sort of stepping back from my own view of these things and just take it back to, if I were making a decision about funding, what would I want to know? And obviously, one of the first things that people always ask is this mandated or not mandated? It's an important question. So I tried to address that for both the ADRC as well as behavioral health services. And then I tried to give you I did give you the statutory authority for those programs and what it requires of us. And as you see, you know, generally statute isn't, I shouldn't say generally. Many times statute is not prescriptive. It tells you needs to do it, but it doesn't tell you to what degree that you need to do it. So if you look at that first page of behavioral health services, the County Board of Supervisors has primary responsibility for the well-being, treatment, and care of mentally ill, developmentally disabled, alcoholic, and other drug-dependent citizens residing in the county. So we are primarily responsible. It doesn't tell you to what degree. You know, it doesn't tell you have to provide 18 programs or 2 programs. It doesn't tell you need to serve 10 people or 10,000 people. It just tells you that we have the primary responsibility. So then I tried to, as best I can, and it's a little challenging in behavioral health, a little less so in the ADRC, it's a little challenging in behavioral health to pull the pieces apart and drop them neatly into a category, because it's easy with programs. It's easy with programs like comprehensive community services, where we have 100% cost reimbursed funding. I can tell you how much that costs and how much we're going to get back, and that's pretty easy. Some other things, so we receive a large grant from the Department of Health Services that covers behavioral health services funding. How we spend that grant, it's about $1.2 million. How we spend that grant is our discretion. So in our county, we choose to have some of that money's in our outpatient mental health clinic, some of that money's in our community support program, some of that money's in the mandated services that we have for people who are committed or on a settlement agreement as a result of an emergency detention and a mental health commitment. So how we split that up is county discretion. So I did the best job that I could of telling you roughly what amount of levy is in each of those programs. But the roll up to how much levy is in all of behavioral health programs is accurate. So if you wanted a more granular description of, for instance, like the community support program, we could perhaps do that. It just gets a lot more complicated to do that. But the roll up of knowing that there is about $500,000 in all behavioral health programming of county levy that serves all of these things that are laid out in this document is accurate.
Yes, Supervisor Steve.
Does that break out, and this may be a dumb question, but it costs, the levy is 500 grand, let's say. So does that enter, does any money that's gotten from the state or federal because of what we do, is that in there anywhere?
Yes, this is like, take all of the cost, apply every other source of funding, state money, federal money, third-party billing revenue, and then what's left is that $500,000.
But if you were just looking at the $500,000 and saying, that's too much, I want to cut it. Let's just say that you cut it $200,000 to save. That'd have an adverse effect on what you would be accessing from the state and federal, wouldn't it?
No, because our match to the state money, our match is a required 9.89%. So essentially, if they give us 1.2 million and our match is about 10%, it's about $120,000. I mean, it's a nominal amount of money. We have what would be called overmatch in behavioral health by, if we were required to have 9.89% of whatever they give us, then we have 500,000. So we're overmatching it.
Side are you on?
Just sharing the information.
Yes.
But we're also a county without a lot of community resources available. You know, we're not like like an Eau Claire or a Madison or a Milwaukee that has a ton of mental health providers.
Yes, yep, that's true.
The Twin Cities, yeah.
And I think that, you know, I mean, I just know that the Health and Human Services Board has been greatly supportive of all programming in veterans and public health and DHS, and I'm incredibly appreciative of that. But I know that as we move into a complex budget season, you all get pushed as well to justify why behavioral health versus something else. I'm not even going to say something else because I don't want to say that I think something else is more or less important, but just why behavioral health versus something else. If we're going to invest our $500,000, why there? And so I just tried to give you some foundational information for that. The ADRC is a bit more complicated. And I have to rewind your clocks a bit back to pre-2008. Before 2008, counties determined eligibility for publicly funded long-term care. So that's a fancy word for saying all of those supports that people need to stay out of an institution as they age or they're disabled. So if you need respite care, or you need daily living skills training, or you need employment training, or you need adaptive equipment, or you need a home modification, and you don't have the financial means to obtain that, and you're eligible for Medicaid, then there was, again, going back to that, actually that statutory requirement back on the behavioral health side applies on this side as well. We have primary responsibility for treatment of the developmentally disabled in our county. And then we also have on the elder side. So back in that day, we determined eligibility and we delivered the services. So we contracted with a number of community providers who provided those services, but we had across the state, enormous wait lists for those services. Sometimes people would come on a wait list. So most frequently, what would happen would be, I'm the parent of a 17 to 18-year-old youth who has perhaps a significant cognitive disability. They are not able to care for themselves unassisted. So I know my child's going to transition from being a minor to an adult, and I know that they're going to need a guardian. And I know that they would really benefit, like I know that I'm getting older and I'm not necessarily going to be able to provide care to my child for forever. And there needs to be this transition plan to what their adult life will look like. So they would come to our agency, we would evaluate that, screen that, they would be financially and functionally eligible to receive services, and they would go on a wait list. And because that wait list was a most in need, not a first come, first serve, they might literally die on that wait list because they might never become the most in need. If I'm caring for my adult child, and I'm able to do that, maybe it's only when I die that they become most in need. And so there was a long standing recognition of that as a problem. And so the state and the counties worked together over a long period, about 3 years, of doing what was called long-term care redesign. And basically the counties retained the responsibility to establish eligibility for publicly funded long-term care, but the provision of those services went to managed care organizations, or the IRIS program, which just means I coordinate them on my own behalf as a consumer. Essentially with the commitment that the state would eliminate wait lists for services, and have. So in our area now, there are, I lose track because they kind of change names and they move around, but I believe there are 3 managed care organizations which serve Dunn County. When we first started, there was one. For many years, actually, there was one. Now I believe that there are 3. There's at least 2. There might be 3. Sometimes they merge together. But what the state said was, we were giving you money to purchase all of these services for all of these consumers. When you were the provider of those services, you can't keep all of that money when we're going to do it. So we're going to take some money back from what you've given us. And so there was a long negotiation about that, and they settled at, we would pay back going forward into the future for as long as, however, till somebody changes it, we would pay back 22% of what we previously received to provide all of those services. So in our county, that's $396,401. Called the family care payment. And we will pay that even if tomorrow we decided that we were not going to have an ADRC and we were not going to provide aging services. We will continue to be responsible for paying the state essentially for the provision of long-term care services for Dunn County residents in the amount of just under $400,000. So when I say it's a little bit more complicated, the ADRCs are not mandated. Aging programs even aren't mandated. Somebody has to do them, but the state is not going to do them on our behalf for free. And so we would continue to make that payment. The other difficult to kind of grasp, but true statement is that aging programs are expensive, and the ADRC revenues help support the aging programs. So particularly the senior nutrition program costs us, and I wrote it down, about
706.
Yeah, and how much levy is in that? About $222,000 of levy is in that. But if you kind of work through all the math, you'd see that in the end, if you took that $890,000 at the end, and you took out the family care payment, which is about $400,000, and you took out adult protective services, which is another mandated program that we don't get to get rid of, even if we don't have an ADRC. So if you took out the $400,000 and the of a family care payment and the $200,000 of adult protective services, now you're at $600,000. Everything else is kind of rolled up into that, and the ADRC helps fund some of those other services. So not a reason to keep it or let it go, just to know that it's more complicated than saying, well, let's not have an ADRC and let's just do aging programs, or let's not do aging programs and let's just have an ADRC, or let's not do any of it. If that were the case, we would still be on the hook, if you were to say, for the $400,000 family care payment and the adult protective services costs.
I love mandates. They're great.
I think this is spectacularly helpful, and
Yes,
I
yes.
really appreciate it, because as our budget situation is critical, this committee is going to have to spend a lot of time looking at pretty much every detail of our funding. So I spent a lot of time with this. I thought it was extremely helpful.
Yep. I hope that it's a good reference document for you going forward. So next month, I will bring to you economic support and family and children's services. By and far, a vast majority of our levy is in family and children's services.
Yeah.
I mean, it's just, it's about I suppose I could look at my financial report, but it's about a $4 million program, and we get about $1 million of support for it. So it's got a lot of money, a lot of county money in family and children's services.
Chairman Bartlett.
Yeah, I remember what Gina was said, that we don't have to, when we got to budget time, his favorite saying was, we don't have to it's mandated, but we don't have to do it at the level we're doing it at. So if we don't do it at the level we're doing it at, then we have people that aren't getting help.
Correct.
Does the state step in and help them, or they just don't get help?
They just don't get help.
They
I
don't
mean,
get help.
I don't want to say that across the board because I think that we'd have to dig into the details to that. But say, for instance, we said, we're not going to put so much, we're not going to put $500,000 in behavioral health. We're going to eliminate having a community support program. Then for those 35-ish, 34, 35 people, they would either just be served through their standard like Medicaid coverage as outpatient basis, but there's nobody else that would do it.
Or they end up needing to be hospitalized, and
Institutionalized,
then
right.
we end up paying the bill for them to be at
Winnebago.
Right.
Yeah, that can happen.
Right.
Mhm.
Or they wind up in trouble with the police. and
Right.
we wind up
But those are the really hard, like that's and I'm willing to have the conversations and will be as candid as I can be about all of that. Those are the harder things. It's like because so for instance, like in Child Protective Services. So we do tons of remedial work to try to get families to be functional, to have their kids be able to be in their care. We can cut back on that. What I can't tell you is what that results in delays in kids going back home, or termination of parental rights actions, or worker turnover because they don't have the resources to do what they're supposed to do. Those are the potential ramifications, but literally impossible to predict what those are.
But the reality of it is this, this budget cycle, unless something changes with the ARPA funds or something
Say
that,
ARPA, yeah.
we're looking at that we only have so big a pot of money every year, and it's stayed relatively the same for 10 years or more. So, services are going down, and if you look at the highway, we've cut that since 17 to, I believe it was 19 or 2019. It went down $3 million in funding. And so they kept using their fund balance. Well, that's gone now. So now, we can't keep doing that anymore. And we've cut it so much that we've actually been losing money from the state because we haven't been putting enough in there. In the sheriff's department, I don't honestly know. Maybe we could tell him he could get along without as many deputies, but the bottom line is it doesn't seem like crime has slowed down a lot. So I don't know where we can save there. And I don't know where we can save. So we're going to have to look at, I'm glad you're bringing this up to us, because we're going to have to look at some place in the county. We're going to have to come up with some money. And I'm just waiting for the next thing to come down shoe to fall. It could be home health care or,
I would be remiss as an administrator to not know that. So all that I feel like what I do have control over is to get you good information to
Right.
make those decisions.
Yeah.
Because in the end, it is a balance between, and because I think Dave, you've said this, as we've spoken with the legislators, no one's going to argue that these are all good things to do.
Right.
It's not like,
Right.
let's just get rid of that really bad thing we do.
Oh,
That would
no.
be easy.
Yeah.
But that's not the reality. The reality is they're all very helpful, good community well-being kinds of things that we do.
Yeah, I guess you know, why I was asking the question is, it'd be nice if we could, if there was a service that we went to, that would put a lot of pressure on the state, so they would realize that they're not stepping up the plate, but it doesn't seem like that's gonna be the case.
Might be
too
wishful
much,
thinking.
you know.
Dr. Hall, did you have a question?
I have a question born out of profound ignorance, and it's a little embarrassing, but so the county budget, is that all coming from property taxes? Like, where does the county budget, where does the county money come from?
Well, a portion of it comes from levy, property taxes, yes. And we get a small portion from sales tax at 0.5%.
Okay.
And we get a registration fee that we instilled a couple of years ago that this year we have to decide if we're going to continue it or not, but that has to be used for roads. And we can't decrease the levy any more than it was when we started that registration fee. So if we keep with the registration fee, we have to put as much levy in to roads as we did whenever we started that 19 or whatever year it was. So
is there any
And Dr. Hall,
possibility?
the local levy is limited by state decision. And it is based on net new construction in the county. It's a kind of complicated thing, but it does not keep pace. I mean, it just absolutely does not. That's a huge issue for counties and local units of government.
I was just hoping that maybe we'd get some boost from the housing situation right now, and home prices are going up. My property taxes went up because my darn in-laws built a fancy house down the street from me.
Shame on Catherine.
So one of the things that's happened, one of the things that we talked about this a few months ago, but it was fascinating to me to know this, so I just share it. We talked about this a few months ago when we talked about housing. So Diane's right. So more than a decade ago, the legislature implemented levy caps, meaning you can only spend what you spent at that point in time, plus whatever gain you had in net new development. In Dunn County, our assessed values continue to rise while our net new development drops. So that would mean your house, my house, us who've had houses, you know, our value of our house does continue to go up, but that's not a new house being built. And the new houses and the new Starbucks and the whatever being built.
Higher property tax that I'm paying, where is that money going?
To the state. Yeah. So the state collects that, the state collects the money and then they disperse it back to the counties in a variety of forms, but mostly in what's called shared revenue.
Your taxes go for the state, the county, your local school district, Chippewa Valley Tech, you know, the vocational school. I think that's a 4 pots in it, Dave.
I think so.
Local municipality.
And your local municipality, which be for you if you live in the city, be the city.
Yeah.
For the rural people, it'd be the township, where I live in Colfax, be the village. So that's where all your tax money. And when you get your tax bill every year, you can look, it'll tell you the percentage that you're paying for each entity.
Okay.
And so that'll tell
And
you.
so the state decides how much comes back to Dunn County coffers through this formula or something.
Yeah, through
It's a-
shared revenue.
shared
Yeah, it's a
revenue,
formula.
But that's not always consistent either.
I'm
Well-
just, you know, the question is just when, as my property taxes are going up, why is our county budget not going up? So that's.
I guess a short
Because
answer,
it doesn't help the county budget.
a short answer would be that your county taxes might stay the same. But if the school raises their taxes, your tax bill's gonna go up. If the state raises their taxes, your bill's gonna go up. If Chippewa Valley Technical School,
Well, it's
they
just
just had a
based on
60 or a
the,
$90 million building project.
yeah.
And so do your taxes go up? And so that's why the county could stay level and your taxes could still go up.
Well, I'm just saying because my assessment has gone up, right? And
Sure.
that's what's driving.
Right.
Yes, right.
My
Sure, you will
taxes
pay more
going up.
taxes, right?
Right, so it's just, it would be nice now that, it's such a seller's market and there's, home prices are going up, so everybody's assessment is going up. It would be nice then if those increased tax dollars actually then.
Went to
came back
programs in the county, but in
Yes.
fact, they do not.
Or actually the school districts too, because I
Right.
mean, we're bound by levy also.
Levy
We
limits
can't
as
raise
well.
it. We can't.
I think
The funding formula.
As far,
There you
as
go.
far as counties, we have very little ways of raising revenue from
Yeah.
what it is because of the levy limits. So one way we could do it was the vehicle registration tag.
Yeah.
We can raise that. We can borrow for some things. So we can borrow for capital improvements like buildings. We could borrow for fixing roads. That ends up being long-term debt, and that's
Yeah.
over and above
Yeah.
the levy limits. But the problem is,
You gotta pay that
Dunn,
debt.
well, Dunn County is a poor county.
Yeah.
And right now, our per capita debt is sixth highest in the state of all the counties. And the majority of that is because of the neighbors. And that was 20 million or whatever it was, I don't remember, but it was a lot of money. So until we get that paid down, there's a number of supervisors, and probably me included, that would rather not go out and borrow a bunch more money to
Right.
do things. Now, our capital plan that we've adopted, which doesn't mean we're going to do it, but it's a plan that we've adopted. The plan calls for borrowing $3 billion a year for capital improvements. We've identified, which is for a 5-year plan, that's $15 billion, but that 15 million was cut down from around 40 million that the department heads identified as things that were going to have to be done, that they felt would have to be done in the next 5 years. So that's, that gives you a
welcome.
little bit of an idea of what happens at the county level.
Welcome to county
Yeah.
government.
Why we look at things and do things the
Right.
way we have to.
Yes, I'm sorry, Supervisor Steen.
Yeah, and what Dave said is correct, but there's one avenue that could be pursued, but and it's called a referendum.
Yeah.
And that's where you'd go to the taxpayers and say, we want to exceed what our limit should be by X amount for X amount of years for this reason. That doesn't happen. It hasn't hardly happened at all, I don't think, with counties. But it has happened a lot with school districts.
School districts have.
You know,
because
and
of the
I
limits,
I
levy
think that you're
limits.
going to see this, and I could be wrong, and I hope I'm wrong, but all we're doing is cannibalizing ourselves. The
Yep.
county, the city, the townships, the villages, because we can't even keep up with inflation. Okay? Referendum is not a very popular thing, but you could go to the referendum. And then as far as your property taxes, I just want to say this. When I talk to people about property taxes, you look at the amount of money that your local government needs. That's how much money they need. They're going to either get it through your evaluation or through the mill rate. So if your valuation goes up, theoretically, your mill rate should go down. Follow what I'm saying? Well,
It's complicated.
Well,
No, I understand.
Yeah,
If the amount was
And so
increasing.
I just say, you look at whatever level of government you're interested in, see how much money they need. Because they're going to get it. They're either going to get it because of your evaluation, or they're going to get it because they raise the mill rate. But they'll get what they want. So the mill rate and the evaluation is kind of a specious argument, because it is all run by how much money that each entity needs. And what do they have to do to get that on your valuation or on your mill rate. Does that make sense to you?
It does, but if the state caps what the county can get.
As they do,
Yeah.
Which they do.
as they do.
Then the local government doesn't necessarily get what they need.
That
Well,
is-
no,
that is
that's-
absolutely correct.
And that's why the third leg of the stool, which is not discussed very much, is a
Is
referendum
the reference.
to exceed the limits that they put on you.
So
And-
one of the ways that, so like your increased taxes
Mhm.
all rolled together and then the state covers, the state can send more of that money back in various ways, shapes or forms to the county. So when we do a lot of advocacy, and in the, every other year in the biennial budget, I think David and I sat through like 8 legislator discussions where we're saying, okay, the governor's budget proposes $5 extra million out of the general purpose revenues for this, or 8 million for this, or whatever. And we support that because while it's not increasing our levy limit or raising the levy limit, it's providing additional revenue to the county. But that was the conversation with the Birth to 3 program, where there was a direct ask for additional funding because counties have so much money in Birth to 3. And essentially the answer was no.
Yep.
So,
Because that was the answer for most asks.
well, for a lot of
For a lot of
yeah.
Schools did the same thing.
Most of them.
like,
Yes.
no.
Yeah, I think
Right? I
think
mean-
Dr. Hall is right. I think it's most of them went down.
And I
think-
didn't want to get that message saying
Right.
that they're reducing my taxes. I want.
And they have, right now, they have an opportunity to fill a lot of holes that need to be filled in state and county government through, because they have a lot of extra revenue. And
Right.
they're looking
Their
at,
projected revenue is.
you know, they're looking at gonna give tax cuts
Cuts.
and basically cut. And people are used to paying a level of tax and they're
Yep.
willing to pay that for the services. Let's take that money and fill some of the holes that are in
Yep.
the system, whether it's Birth to 3 or roads or
Schools.
you know,
anything,
fixing
yeah.
schools or fixing,
Yeah.
you know, doing the I don't think of schools as much. I'm county oriented now, you know, but you know, the mental health thing in
Open
Chippewa.
space, yeah.
I mean, there's
Yeah.
so many holes that they could take that extra revenue and they could do so much good with it.
Yep.
And we paid it already, but
Right.
now they're thinking of giving it back to us and we're gonna still be in the same hole.
Eliminating business
Just-
property tax
Right.
was the newest
Yeah.
one.
Yeah.
And there remains seemingly bipartisan support for keeping levy limits in place.
Yes.
And so I think, you know, kind of the summary to it is, so when we had the conversation about, say, $500,000 worth of levy in behavioral health, services for example, if you all and the county board thought the behavioral health services were the most amazing thing ever and should get an extra $250,000 of levy, the only way that that could happen would be by not doing something else that the county's doing. And the flip side of that would be that $500,000 sits, I'm going to say, vulnerably, because there might be another area of county government that really does need some of that $500,000. That's the trade-off. There's just so much in the checkbook, and that's what you get to.
Yeah, every year wages go up, insurance goes up, you know, expenses go up. And we can only collect the same amount that we did the year before. That's the problem.
We don't have fluff.
Yeah, no.
Supervisor
Fluff is all
Cromley
gone.
has a
It's all gone.
Yes,
It's been
Supervisor
gone for
Cromrie,
years.
thank you, Dr. Hall.
Instead of, and this is directed to Chris, instead of having to give up another program, is there someone solely dedicated to applying for grants that might be missed that we haven't applied for in the past?
There's not, although we do a lot of grant writing within our current structure. And so there's a kind of a little bit of a rub with the grants as well, because you might get the money for a program or an activity, but you don't necessarily automatically get money to administer it. And so we run into a bit of, and we're kind of at this point right now with on the finance end of it, that they have increasing amounts of the departments going out to find grants, but now we're running out of administrative capacity to administer them.
Yeah, grants aren't free. I've
No,
learned
grants
that.
are never free.
Especially this year, I've learned that grants are not free.
Okay, are there any further?
Let me just say on a
Please.
better, brighter note, I don't know exactly what happened in the printing, and I sent we have a new person doing our board packets, so somehow she missed the last pages of the financial report, but that is not to hide anything bad because it's actually a good report. At the current, I'm just going to give you the bottom line. At this point in time, at mid-year, we are $456,000 to the good.
That's essentially expenses through
April. And there's nothing tracking, like, at this point in time, there's nothing alarming to say, oh, that number is going to really dramatically change.
no
in
shoes
any-
to drop.
No shoes to drop at this stage. Not that there can't be one this month, but there's not yet.
Supervisor Steen, do you have any questions?
I'll wait till we get to the vouchers.
Okay,
Oh.
all right. All right, I'm gonna move us ahead unless there's something else, Chris.
No, nothing else.
Okay. Item number 10 on our agenda is review of the May 2021 DHS vouchers paid. First item, I would like a motion and a second before we start to ask questions.
I so move.
Supervisor Steen moves, Supervisor Cromrie seconds. Now, questions, Supervisor Steen.
Yeah, I think it's on the second page there. We've got County of Trempealeau for,
Yeah.
it looks like, do we have 3 people that we're putting down there, or what's the deal?
That's probably, I mean, yeah, they would be payments for people that are in the Trempealeau County Healthcare Center on their mental health unit.
Right, and that's a responsibility that we have no control over, is that correct?
Right.
So that's what I thought, but thank you.
Or we're just helping Trempealeau County out because we thought we had a lot of extra, so we send them some money.
Yeah, they need it.
God bless you.
Yes, Supervisor Bjork, please.
I got 2 things. The first one, and I suppose I've been told this before, AMSO is what?
It's agency management, support, and overhead. So it's kind of it's a state term that they use in the Department of Human Services world, but it basically covers me, the deputy director, the finance our financial piece of what we do, our clerical staff that are spread out over, like our reception staff that aren't dedicated to a program, and then the small amount of related expenses like our telephone system, our postage, our office supplies that are split across the agency, those kinds of things.
What was the second, Supervisor Bjork?
Well, first of all, thank you for increasing the. I really
Font
do.
size?
The font size?
That
It
was
is bigger.
just for you, Larry.
I appreciate it too.
Fine. Well, thank you very much.
Supervisor Bjork, did you have a second question? You said you did.
Yes, I did. And it has to, again, I keep wanting to know about house calls of Menominee and why the description is always labeled as agency contracts, salary, or agency contracts, travel. And it just seems to me when we're trying to keep track of our expenses, shouldn't we have some, maybe there is it here, shouldn't we have something that says how much we spend every month on house calls of Menominee? I think in December it was, just way over previous months, but is there a number someplace that says this is what we're spending this month, this is what we spent last month? How do you oversight that cost?
So a couple of different ways. So one, at the beginning of the year, we tell house cows the top end of what we're going to spend with them. And for them, it's somewhat easy because that 99.9% of the cost to house calls are staff costs. There are staff that are side by side with county staff. So in the Family and Children Services section, there are, I think, 12 or 13 social workers. I want to say maybe 6 or 7 of them are county staff and 5 of them are house call staff. So at the beginning of the year, we list out all of those staff in a purchase contract with house calls. We calculate out the costs and we say, here's the maximum of what we're going to spend with you if all of these things stay the same. If someone leaves and we don't replace the position or whatever, we're not committed to spending that amount of money, but there's a cap on how much we're going to spend on them based on our projection at the beginning of the year. Then if you look at the monthly financial reports, not the vouchers, but the actual financial report, and I realize, you know, again, it's kind of little tiny print, but there's none in AMSO. But if you went to behavioral health on the second page, and you went the first, so about just a third of the way down the page, there's a blue line that says CCS. Are yours in color? Yep. Blue line that says CCS. And if you kind of go look down that line to the big number, we have all our entire CCS staff are leased staff through house calls. So if the amount that we've spent through April continued through the end of the year, we would spend $954,000 with house calls for our CCS leased staff. So there isn't, I do know we do have internal finances that we would track the big roll up into the total number, but all of the individual staff numbers are all in these different sections under that agency contract salaries. It kind of rolls them up into, that's how many CCS staff are. If you turn to the page, you'd find the same thing for crisis. You'd find a much smaller number because it's a much smaller staff of $143,566 of crisis staff are in there. So there's really 3 ways that that's monitored. One, we have a purchase of service contract with them that says the absolute top limit of what we would spend. We have a monthly financial report that tells you where it's being spent, actually 4 ways. A monthly financial report that tells you in which sections it's being spent, and kind of rolls it up into a big number for that section. We have the vouchers where you can look at it in the granular, what did we spend? I mean, each of those $2,453, that's someone's salary. $28.37 might be their mileage costs, whatever that is, that's there. And then lastly, I had some other fleeting thoughts that's gone. Lastly, if you wanted to, I can pull up a financial report and I could tell you the sum total of what we had spent to house calls inside of 3 minutes out of our financial system.
Supervisor Bjork, I'm sorry, you're muted.
Okay, at the county board meeting, the county board chairman or the Paul Miller, excuse me, comes and talks about purchase orders over $40,000.
Mm-hmm.
Paying for concrete or blacktop supplies or trucks or something like that. And this is a lot of money. And as you discussed earlier, what's is mandated and what is done, it just seems to be, we need to shine a light on how much money we're spending here.
Right. And I don't disagree. And so those purchase orders do come in that report. The purchase order for house calls comes in that report. that comes forward from County Manager Miller. So you do see that big dollar amount. But the other thing is, and this is kind of the piece that I just keep coming back to for you to remember that these are positions that we have deliberately changed that were off, not all, but many of them formerly county positions, where there was a deliberate decision made on the part of the policymakers that it is less expensive to hire a leased staff than a county staff. And so we will hire them through house calls instead of the county position. So at one point in time, say a decade ago, all of the Family and Children Services social workers were county staff. When someone left, we made an argument as to why that position should be filled or not filled, but filled. It got filled. It was a county staff person. And then there was a recognition that it was a lesser expensive model to hire some of those positions through a leased organization. And that leased organization for us is House Calls. And they won that privilege of being that organization through a request for proposal process. So that's why we don't buy a few positions through Manpower and a few positions through Express Temp Services and a few through House Calls and a few through all of the other places. That's why they're all in one spot, is because that was bid out to them, and that was awarded to them.
I heard a lot of that before, and I agree with the way you're doing it. It's just that I'm uncomfortable with not knowing what the monthly payment is to provide these services and how that might compare to payment for services a year ago. So I'm just uncomfortable with not knowing the dollar amount that's going, and just giving me 100 or 200 vouchers instead of what the cost is each month.
Yep. So that information is actually in the financial report, not in the vouchers. The vouchers just basically are kind of like your checkbook register, although people don't really keep checkbook registers anymore, but it's kind of like your checkbook register. A lot of people don't. But it's kind of it's the listing of all of the bills that were paid. And then that's what you're seeing. So you're seeing the line by line by line of a checkbook register, basically. And then the roll up of that into bigger chunks of where it gets spent is in the financial report.
Which we do. I mean, it is more complicated, I suspect in some ways, but we do get that each and every month.
But it is definitely more complicated than, say, for instance, like Greg's budget in veterans, where it's just, a small budget and pretty straightforward in terms of cost. Now, it is very, very easy for me to do for you a comparison sort of from year to year on house calls. What I would tell you is, and I would gladly do that, or I can tell you each month what the total is for house calls. What I would tell you is it's not going to be particularly helpful to compare it from year to year, because we continue to move positions from county positions to house call positions. So in this last year, I believe that there were 3 positions that moved that were formerly county positions and are now house calls positions. So if you looked at house calls last year and house calls this year, it would look like we're spending way more money. But the only way to get an accurate picture of that would be to look at the county expenditures last year and the county expenditures on staff this year, and see that number is going down. And we actually will have an opportunity to look at that when we get to the budget discussion in August, where you'll see those 2 comparisons standing year by year, because because I have to make sense of it in order to do that comparison, but just providing you the flat out numbers, and I'll run the number for you next month so you know what the sum total is. But it's not particularly telling because they shift around between the 2 categories.
Are we ready to call the question here?
I think Dr. Hall.
Oh, I'm sorry, Dr. Hall.
I just wanted to say one thing to add on to that, because I agree with Supervisor Bjork that it's really hard to kind of understand and get a picture of what's going on. So what would be super helpful for me is okay, these are our county employees' salary and fringe, and these are the ones that we contract through House Crawl, salary and fringe, and how many employees, and like, it would just make more sense that way. So if that's something maybe coming up into August or something.
Absolutely. That's an easy thing to
Because then
do.
It's in the budget.
then it's like, oh yeah, we're paying for these employees that are doing the work of the county on behalf of us, and this is how much it's costing for these many people in these different departments. That would be helpful, because I agree, it's very strange seeing the vouchers
It's the checkbook.
without knowing exactly where it's all at.
Any further questions before we move on? We have a motion and a second to note review of the April budget adjustments or vouchers. Don't listen to me.
May
all-
vouchers.
May vouchers.
May.
That's what I said. Don't listen to me. May vouchers. All in favor, say aye.
Aye.
Aye. Opposed?
Aye.
One opposed. Vouchers are approved. Moving on to the DHS annual report, which was excellent. I need a motion to, we don't technically need to approve this, but I'll accept a motion to do so. Supervisor Steen?
Yeah.
Is there a second?
A second.
Ms. Barker seconds. Any questions, comments? I assume that if you have any changes or observations, you would get those to Chris. Any comments on the report before we vote? All right, all in favor of approving the 2020 annual DHS report, say aye.
Aye.
Aye. Any opposed? That goes forward. And then we have budget adjustments and a resolution. And please, on these budget adjustments, look at the ones that Chris sent later.
There was a revised.
They were revised. There were several items that needed to be changed. So the ones that are in your packet are not the ones to look at, the ones that were sent later.
That was Sarah's work. wasn't She
It
sent them
was.
up. She's not here.
Right.
That's a mark.
We'll blame her.
That's a mark.
Okay, so the first, let me check my agenda. Is the DHS.
Yep.
The DHS budget adjustment, $554,676. I need a motion to approve.
I so move.
Supervisor Kennedy, is there a second?
I'll second.
A second.
Dr. Hall? Any discussion? Anything to add, Chris?
No,
These
I
are-
just
these
think
are
I just think when, it is all so complicated. So if you ever think I'm just repeating myself, throw a spit wad at me or something, but so at the beginning, well, late this year, the county will pass a budget, and it will include sort of the amounts that have been approved for the Department of Human Services and Public Health and et cetera, all the different pieces to spend. When we receive additional funding, then we need to pass an adjustment to that budget to gives us the authority to spend it. So let's say we had authority to spend $100 and somebody sends us 10 more. We can't spend that extra 10 until we do a budget adjustment to spend it. And so this shows you where we intend it and how much. So it's got a expense and a revenue that balance each other out.
And these come from the executive committee and go to the full county board. Ready for the question on the DHS budget adjustment?
Yes,
All in
ma'am.
favor?
Aye.
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 Opposed? That DHS 2021 budget adjustment passes. And then from the Department of Public Health, this one is in the amount of $1,100. I need a motion.
I so moved.
Supervisor Steen, a second. Ms. Barker, any discussion? Chris, anything to add? KT is not with us. All right, all in favor?
Aye.
Opposed? That's also going forward. And finally, this is something that KT has wanted to do for a long time, but there simply hasn't been time to recognize the contact tracers who have done such an excellent job of keeping us all safe. So here is a resolution recognizing the work of the Dunn County COVID-19 contact tracing team. Again, I will need a motion on this.
I'll move.
Dr. Hall, is there a second?
I'll
A second.
Chairman Bartlett seconds. Any questions, any comments, any issues? I think we're all going to be happy to vote aye on this. All in favor, say aye.
Aye.
Any opposed? They are going to get some kind of paper certificate or,
Nice.
which is probably not,
They worked.
not
super
enough
hard.
to compensate
They
for
worked
them
super
for the
hard.
work that they did to keep us all healthy. Yes, Chairman Bartlett.
I think that they should get that bonus. This
I
is
will.
the end of this week.
I'm
Maybe.
sure when it runs. Well, but I don't, they're not all employed. That's the,
Right,
so the bonus is only for people who are employed.
for accounting employees.
So some of these are from UW Stout,
Oh, okay.
Yeah.
but I think the, so the volunteered would not be eligible. Some of them probably are.
Someone.
Some are, yeah, for the one-time bonus. Okay, unless we have any announcements or any other business, we,
Madam Chair,
Supervisor Bjork, sorry.
I don't want to take much time. I had a fellow visit me here the other day that had to do with the 4-H program. And they had received a brochure for vaccinations at Stout. And I sort of like, I says, what's the problem with this? And he says, well, he says that they're just becoming too political. Well, I don't want to talk about that as far as the 4-H program, but I think we should be careful not to stigmatize people for whatever reason they choose not to be vaccinated, whether it's a political choice or it's the way they view the science or just a personal choice. There's going to be a group of people that will refuse to be vaccinated. I was first in line the best I could, as soon as I could personally. But if people choose not to, let's not make them a group that is looked down upon. Thank you.
All right, thank you for that. Any other announcements or comments?